All right, friends, we are going to clean up your cholesterol. That's what we're going to talk about right now. This one's pretty near and dear to my heart, really. I take cardiovascular health really, really seriously. My dad has been through 2 heart attacks, quadruple heart bypass, and that's what really woke him up for his health, to be like, all right, I've got to change something. And he's the reason I do what I do now as far as chiropractic and functional medicine. And so when someone comes to me with, hey, I have high cholesterol, they put me on a statin drug. Like, okay, sure. You can treat a symptom. That is fine. Statin drugs turn off the production of cholesterol, turn off the production of protein synthesis, and turn off the production of coenzyme Q10. The problem is they have side effects. Well, what are the side effects? Well, the first one is muscle cramps. Why? Well, because you turned off your protein synthesis. One of the problems, the long-term effects with reducing cholesterol by using a statin drug is your heart is a muscle. So if you're reducing protein synthesis, at some point your heart will have to work harder. So one of the side effects you'll see of statin drugs is muscle wasting, muscle cramps, rhabdomyolysis, and eventually heart complications. And so again, you can use it for a season, but you've got to figure out the cause. So one of the things I want to teach you guys how to do is how to increase your good cholesterol, how to clean up your cholesterol. How do you do it? Well, first thing is increase your good. What's the good one? It's called HDL, high density, HDL, high density lipoproteins. The way I think about it is you have all your arteries, you have LDLs that really like to stick to the wall of the artery, and then you have HDLs that are these high density bowling balls that will go through there and they'll actually clean it out. They'll actually kind of roto-rooter open it up and clean out your arteries when your HDLs are nice and high above 60. I try to keep mine closer to 70 to 80 personally when I run mine. So how do you do it? Look at your HDLs next time your doctor runs them, and you want to get that number up. Like I said, above 60 for sure, 70, 80 is where I like to be personally, or where I prefer my patients to be. So how do you do it? Number one is you increase healthy fats. Healthy fats being the key. Not all fats are healthy. So you want to get healthy fats. Fish oil is my number one go-to. Omega-3 fatty acids are fantastic for increasing your HDL. Things like avocados, walnuts, chia seeds are loaded with also healthy fats and omega-3s. You'll find things in grass-fed beef, something called conjugated linoleic acid is another healthy fat that will also help you burn fat as well. So that's number one, increase your healthy fats. Number two, decrease your inflammation. Curcumin, right? Curcumin, it is the active ingredient in turmeric, is one of the most researched routes to actually decrease inflammation in your body, including in your arteries, including with heart health, and decreasing bad cholesterol and increasing good cholesterol. The other two are lifestyle behavioral changes. Smoking and drinking, those two things have been researched and proven to increase your bad cholesterol and lower your good cholesterol. So if that's a thing, work on it. It's easier said than done, obviously, right? I heard someone say you can have a vice, you just can't have all of them. And so if that is a thing, then it's a work in progress. Health is a journey and a process for sure. And there are people and ways to get support and to get help with both of those things. And I understand they can be an absolutely part of an addictive process in your brain, as can sugar. Absolutely. And then the last thing that we absolutely do have control over is movement. Movement matters. Exercise has been shown in research and proven to increase HDL and decrease your LDL. So get your healthy fats, get your omega-3 fatty acids, and decrease inflammation in your body. Get your HDLs up. If you're a patient of ours and you have cholesterol numbers, bring them in. I'd love to see them, help coach you through how to optimize. Right? We don't want to just be like okay, right? We don't want to just be like normal. I want to optimize my health and my longevity so I can be around for my family, my friends, my kiddos, my loved ones. All right, guys, this is Dr. Nixon with Twin City Health.